Good morning. Today we are doing palatoplasty in a 1-year-old child. This patient is a known case of Pierre Robin sequence. When he was born, his chin was quite receding, his lower jaw was quite receding, and he had a lot of snoring issue. Overall, he was maintaining oxygen saturation. Feeding wise he was fine, but a lot of snoring was there. That is like a very common thing in Pierre Robin profile. So I would call this case as like a mild to moderate case of Pierre Robin sequence. Many times there are severe cases in which usually there is a combination of severely receding lower jaw, severely receding chin, and cleft palate, which usually compromise the airway, and in such cases the child has a problem of failure to thrive because the child is fighting between breathing and feeding. So they have a problem with the weight gain, and definitely many times we need oxygen support. So such cases are usually managed if more or less the oxygen saturation is maintained. Probably we can try to gain weight with the RT feed, but some cases may require treatment like tongue lip adhesion. Sometimes we have to do mandibular distraction. Very rarely they may require a tracheostomy, but most of the time these cases can be managed conservatively, and as they gain weight, their airway size increases as the mandible grows, and usually they do not require any severe intervention. But because of receding lower jaw, we may have to follow some criteria for doing palatoplasty. So their palatoplasty is usually done little later than the ideal timing, which is around 9 to 18 months. We usually do palatoplasty between 9 months to 1 year, but in Pierre Robin, we might have to delay the surgery because of the airway issue. The criteria what I follow is when child stops snoring in supine position while sleeping. That is the time when I prefer to operate palate in a Pierre Robin child. And this child also has a tongue tie issue, so we are going to release the tongue tie also same time. And palatoplasty will be done like usual intervallar veloplasty. So that's all about the Pierre Robin patient with a cleft palate, how we can manage this child.